Hello, I'm Robert. Welcome to my channel. And this time it's about, for those of you who are, especially if you're in the United States and you're worried about, or maybe in the United Kingdom too, and it's about how actually the situation is looking really, really good there. That's to say, not right now, but projecting forward a few weeks or months. So look how fast the cases are falling in the United States. And if you're worried about the variants, it's falling even faster in the United Kingdom with the United Kingdom variant, and it's falling even faster still in South Africa with the South African variant, halving every 8 days or something there. So it's almost paradoxical. The worse the variant, the more strictly people are controlling it. And it's almost like that the variants started getting people's attention around then, and then it immediately starts going down rather than going up, as you might expect. So for whatever reason, this is not, you get people saying, oh, this is natural herd immunity. It isn't. It can't possibly be. If it was natural herd immunity, it would be a normal curve like that. It's a curve, it's called a normal curve. It looks a little bit like a hat. This one goes up like that, like a bowler hat, and then down. That's the shape. And we not got that, so it's not that kind of thing. And it's far too soon for the vaccinations. So this has to be public health measures. It's the only thing that people have suggested that it could be the explanation. Though I'm sure we'll have learned experts wondering about it for decades and years to come as to what exactly happened. Anyway, and you can have various theories about it, but the main thing is it's happened, and that at last people are taking this virus seriously, and they're doing healthcare properly. And that's basically what's happening. And this, it may not seem so striking to you, but with my mathematical eye, then it's very striking the way it's coming down. So if it was coming down like you normally expect it to come down, like halving every so many days, then it would be curving out like that. It would be going up like that and ending off something, down, down, down slowly. But it's not. It's coming almost a straight line, especially from there, pretty much straight down all the way down. And that's only possible if the actual, whatever is bringing it down is getting more and more stronger the further down it goes. So whatever measures are bringing it down are getting more and more effective. Now, that's not too surprising if it's the health measures, especially if it's things like contact tracing or testing. So if you've got the same testing capacity as you had before, and you've got the same contact tracing capacity but fewer cases, then you can turn the tests around faster, and then you can do the tracing. You can trace many more people much faster because you've got many more contact tracers for a smaller number of people. It could also be states introducing new measures, though some of them are even easing up. So I'm not sure how much it is introducing new measures, but for one reason or another, it seems to be more and more controlled as time goes on. See, if you continue to the straight line, it would be across zero sometime in March. I don't really expect that to happen, but it's very getting more and more controlled. That's for sure. And that is with most of the measures that the United States is going to take. They haven't happened yet. So the vaccination, so many people have been vaccinated, but it's far too soon to notice the effect. The effect on especially on hospitalization and deaths, quite a bit later down. And the effect on cases, well, it's only amongst the people who are vaccinated, and they're vaccinating the most vulnerable. So you wouldn't really expect too much an effect of that either. Yet there's a 10-day delay before there's any effect on the people who are vaccinated. And so the US is vaccinating more and more people. Let's just bring this up. So it was vaccinating in early January. It wasn't vaccinating many. It took it through to January the 5th. January the basically it was on, though this is a coincidence, but it's about the inauguration day. It hit 1 million, a bit after, the day after, but it's been increasing all the way through. So gradually increased, starting from very low figures in December, and then it's going all the way up to it's now over 1.6 million, and it's still going up, and they're still doing various things to increase the vaccination rate. So it's already on track for 150 million doses in the first 100 days, but it's going to be higher than that. So, but if you look at it, if you go back, so for instance, back there weren't many doses per day then, and it doesn't have the total population there. I'd have to look at another graph for that. But anyway, the so I was back here. I just keep going with what I was doing. Where was I? So it's not, but the vaccine could be just beginning to kick in there. And anyway, so when the vaccine fully kicks in and you've got everyone vaccinated, then you can expect it to go down for the to perhaps a 10th or 20th of the number of cases, and then even if you've got the a variant like the South African variant evading the vaccine, then it's still going to have a big effect on the severe cases and the deaths, and those will go way down. Now, let's look a little bit under the hood as to what's happening underneath that case, underneath that overall figure. So if we go and look at all the states, then remarkably they're all going down, and they've all got spikes at about the same time. So something very dramatic happened around that time, and most of them have. And so, so something changed and changed the way that public health was working across the United States in early January, they're all, nearly all, are going down very fast now. Some extremely fast, and the none going up. None of the states. Now you can go and inspect that in a different way here, where if you put it to states, I'll just double check what I just said. You could look at the infection rate. Oh, there's one going up, Alaska. Alaska's going up slightly. Yes, if I go and look at that. So if I go and look at that and look at Alaska, then I might find that it's slightly increasing. It's just a little blip thing. So you can see it's basically going down, but it's a little blip up for a little while. So, but all the others, South Dakota is the next highest after that. They all got the infection rate. So that means 100 people infect 101 people. That means 100 people infect 95 people. And if it's going down, if the number of people you infect is less than the number there were before, then that means it's gradually going down. It'll keep going down so long as you can keep the infection rate down. But now, if you go to counties, which is the smallest unit here, then if you look at those, and now, well, you do it by the infection rate. The highest is very high, 3.25. The lowest is very low, 0.35. Medina County, and I'm going to look at that in a minute. And then if you go to sorted by the daily cases per 100,000, you some are right up to 1 in 1,000 getting it. That's the very highest, which is another one in Texas. But if you look at the lowest, and look how many are already at 0 cases in the last day. And if you scroll down and down and down, you've got to go quite a long way. You've got to 80 there, 80 ... And it's now 80, the first 82 have 0 cases. That varies, that fluctuates. Sometimes it's a bit more, sometimes a bit less. But around 80 or so, and going above that, every day, different counties each day, you find that have had 0 cases on that day. And these are not just counties that have been at 0 cases all along. They've had high peaks, and then you find they've dropped down, and they're all down back to 0 again. So this is really quite a striking thing that's happening, that parts of the United States are already beginning to become COVID-free. And that's hidden under the hood. You don't really see that so clearly on this picture, or even on this page. It's not clear, because if you go and look at the individual, you can go to look at individual counties, but it's really quite, it's not easy to get that overview that you have of on this page. So now I want to look at a particular county, Medina County, and this has a population, there's its population, 51,000. So that's quite a large, high population for a county that this is not at 0 yet, but it's very close to it. So I'll go up to the population. So the thing is, look how dramatic the fall is. That's the one that had that 0.35. So if you look down here, this is the infection rate. And when it's above 1, then the cases are increasing. So that's 100 goes to 118. When it's below 1, they're decreasing. And it's now at 0.35. That means 100 would go to 35, would go to say 12, would go to 4, go to 1 or 2, and then it's gone. And so it's no wonder that any little outbreak, and it's probably below that now, any little outbreak is very quickly fizzling out in this particular county, Medina County. And so then if you go and look up here, and you can see how quickly it's gone down, it's actually gone more than tenfold reduction in less than a fortnight. So whatever it is they're doing in Medina County, they're obviously doing things right, and they've managed to completely, they're well on the way to getting back to where they were back then. You see they're about the situation they were in March, and then a little bit more. They come down much faster than they ever have before, and they're well on their way to maybe quite soon, after fluctuating a little bit, to start hitting their 0 cases, and then maybe stay down at 0 cases. So Medina is not that far from 0 COVID. I think it might be one of the largest counties that is close to 0 COVID already. And if you go and look at this graph, it's the fastest. If you look at all the previous falls, that was a very gentle one, that was another gentle one, and then there was quite a fast one, but not for long. And this is the longest, most sustained, fastest fall in the total cases. And this is because just about all the states, except a little blip in Alaska, are actually going down. They're all going down together. And so it's no wonder. Now, but the thing is, remember that the vaccines have not really had much effect on this yet. Not on the hospitalizations or deaths, and really not a huge effect on the cases either yet. And then, so we have that to come in, and the vaccines will really start to make a difference, especially for hospitalizations and deaths, in the middle of March. And maybe a bit earlier than that, end of February, we start to notice the effect of the vaccines on cases. But it's not quite a big impact on the cases, because the deaths and hospitalizations, those are the ones that have been targeted with the vaccines, are the people most at risk of dying and of needing to be in hospital. So we should see those figures, these figures down here, and if I can find them, deaths, there we are, there's the cases, there's the deaths per day, which is currently running at about 3,000, and if all those people were vaccinated, that would be something like between 150 and 300 cases a day. So given that they're targeting the most vulnerable, and then they're gradually going down, then you can expect a significant impact on the number of deaths per day just from the vaccines, and the deaths are coming down, delayed from the cases. Hospitalizations are delayed from the cases, and then deaths delayed from the hospitalizations. And hospitalizations, they'll be going way down too. So, the 74,000, and you're talking about, amongst if they were all vaccinated, would be 7,000 or less, depending on how effective the vaccine is. And the vaccine may well be more effective against deaths and the hospitalizations. It might well be that you have almost no, and the World Health Organization said that they have no examples yet of anyone infected with COVID after they were vaccinated that either has needed to be in hospital or has died. That hasn't happened yet. So actually being in hospital or dying because of COVID that they got after they were vaccinated. There are cases of people who get symptoms of COVID, but it seems to be pretty mild, even if it's fairly or moderate, getting on for severe, but not enough to go into hospital. So so these hospitalized cases, then they're going to be, that should be, may even be very significantly reduced, and the deaths too amongst the vaccinated people. It's a bit too early to be totally sure, but for instance Israel with the Pfizer vaccine, and the last figures I saw, it was 66 cases amongst the vaccinated people, and none of them serious. And it would have been over 2,000 cases if they weren't vaccinated, according to one estimate, trying to match a similar population. So if you imagine, every 1,000 would return to 66, and then none of those needing to go into hospital or die, then you have very dramatic effects on these figures, and that we should start to see the effect of that mid-March. So that's still on its way. And then the other thing that we're going to so that's the effect of the vaccination, and the other thing is Biden's America Rescue package. So he's going to use this method called reconciliation to get it passed, which is a process they can only use once or twice a year. Technically, you could do it 3 times with 3 different kinds of reconciliation, but normally they just only do it. There's only just one that they do, and they could do one this year and then another one next year, but they could advance the second one next year to this year. That's part of the reason why he's so keen to get bilateral support. He'll be much more flexible because he can only do this once. But he probably gets some support from the Republicans, but he's probably not enough to pass it with a 2/3 majority. So that's why they've got this reconciliation thing as a backstop. What that means is that there's a committee there right now that's going through the bill, and they are marking out how much each one costs in terms of cost, federal cost. And every item has to have some federal cost, otherwise it can't be included. And then they have to decide the cost in advance before doing the reconciliation, and that is the budget. That is the budget set. It can't be changed after that. And then once they've done all that, they take it through the 2 houses, and then in the Senate, then they'll be able to pass with just a majority instead of a supermajority. And so long as they do this particular process. So Biden thinks that, as I set a deadline for the 14th of March, and that is quite ambitious but possible. So that's when this new bill will certainly go through, either with or without this process of reconciliation. And so when that happens, that's going to bring $350 billion to the COVID control, and that's things like a team of 100,000 extra contact tracers. It's going to be vaccination sites so the vaccination can go faster. It's going to be extra health workers, and just lots of different measures that should rapidly increase this, because it's been the experience of many countries that doing very rigorous, effective contact tracing is about the best thing you can do to get this under control, and that is what Biden is going to do once he's got the funding. So at the moment he hasn't got the funding to employ lots of contact tracers, but by mid-March he will. So we are going to have this going down very, very fast at that point, I think. And then the last thing is that by then quite a lot of people will be vaccinated, and once you don't need to go all the way to herd immunity. You can't have natural herd immunity. There's no such thing. Vaccine herd immunity is when so many people are vaccinated that it doesn't matter what you do, that any kind of outbreak soon fizzles out, because there's just not enough transmission to keep it going. And we seem to have just like two ideas of what you can do. One, you can control it with test, trace, isolate. Then the other approach is to control it with a vaccine. But here we've got both at once. And I don't see anyone talking about this properly that I can see, but it's kind of really rather clear. So this is somewhat me. I'm not quoting a paper that I've read. I haven't actually seen this, but it just seems kind of pretty obvious that this is how it's going to work. So the thing is that, so if for instance it's at 0.82, so that means 100, let's take 0.8, let's take 0.8, let's call it 0.8, I can't actually find 0.8 there, but suppose it's 0.8, so 100 people infect 80 people. Suppose you got to that point, and then you add a vaccine onto that, and suppose the vaccine stops half of transmission. Then that means, and then suppose I'm vaccinated and the people it's transmitting to are also vaccinated. Now, the things that they've got so far, they found that AstraZeneca does a 2/3 reduction in the in even asymptomatic cases. So that's really quite effective. Depending on the various considerations and populations, another one was about 50% reduction, that's slightly less. But what people don't, what you've got to bear in mind is that is the reduction of the infections going from another person to me. I've been vaccinated just my first dose, but the next one will be, it's 10 days and before it has any effect. But say 10 days from now, then if there were 100 people like me all get infected with COVID, then the question get exposed to COVID. If we're in a situation where 100 people like me would have been exposed to, would have got infected in some big party or something, and then these, or big event, and there would have been 100 of us would have got infected, and then if you've got the with the AstraZeneca vaccine, only about 30 odd would get would get infected with the asymptomatic cases, and most of those asymptomatic. But then the asymptomatic spread means that if you've got asymptomatic, then that means that you're likely much less infectious to other people than you would be if you had the symptoms. And that's certainly been the case with the natural disease, that if you're in the same household as a symptomatic case, it's 18%, one study I saw, 18% chance of getting it. And then if it's asymptomatic, it's much less. I think it was less than a tenth of that. And I'd have to look it up, the actual figure. I can't remember if it was less or more than 1%, but that sort of amount. So you would have a huge reduction if it works like asymptomatic natural disease, just from converting it to asymptomatic cases. Maybe the coughs, for instance, are involved in making people more able to spread it to other people. That could be an example as to why there's such a difference. But for some reason there's a huge difference with COVID, much more than there is for flu, where it's only about 50% difference or something between symptomatic and asymptomatic. And then if everyone's vaccinated, then if I get it and then there's someone else, and I meet someone else who is also vaccinated, then I'm producing less of the virus, and then they're getting less of the virus to infect them. So the actual amount of transmission from me to them could be quite greatly reduced, much more than that 50%, even if it's just 50. Say if they were both 50%, then that would up to 75%. You see, so but actually, I mean, they'd have a third of the chance of getting it if it was that third thing, or 50%, 50%. So the actual how does that work? So if a situation where 100 people would infect, 100 people would infect it, then actually it's only 50% of those get them, and then I infect but because it's only 50% is transmissible to someone else, and then because they're vaccinated. Well, I think it just does the 50% thing. Sorry, I was getting mixed up there. Okay, so so if you are at 80, then normally that would be 100 would infect 80, but instead 100 would infect 40 in a situation where normally it would be 80. So that's the this is the you've managed. So what I'm talking about is that if you combine the vaccination with the actual control measures that you're still already doing. So the actual numbers don't. The main point is just the way that you can combine them. So if you had, say, if you were in Medina County, but you only got down to 80% and you hadn't managed to do all that, and then you had a vaccine on top of that, then you would actually infect 100 people, infect only 40 instead of only 80, instead of 80. And that is a big difference. We've done very, very fast. And so, so if you had the vaccine on top of everything else you're doing, it's going to come down really very fast. Especially for cases that are just, and if you've got a case that's just stapling along at one, it's not going down at all. And adding the vaccine could mean it starts going down very fast. If it's going down fast, then adding the vaccine will make it go down even faster. Just by blocking the transmission. So then, remember I said that you're going to have these various green counties that we're going to have, like that. So you go up and look at Texas, and you see it's already got a few green counties, but you've got very few cases. But it's lots of them are red and yellow. But as it goes down a fair bit, then those green cases, there could be more and more of those green counties where it's very, very low risk. And then there'll be a few red ones left over at the end. And so if you, the thing is you've already vaccinated all the most vulnerable, maybe down to the age 50 by then, and then you've got a few red counties left, then you don't need to vaccinate everyone in all the green counties, because some of them will have had 0 cases for maybe for a couple of weeks. And you want to use the vaccine optimally, and the 2 ways in which you want to optimize for preventing sickness. So if you go to counties where there's a big outbreak going on, you're reducing sickness very much in that county. And then also you want to stop the transmission, and again, that's the optimal place to go to the county where there's lots and lots of infection going on. So, and as an example, in England, in summer 2020, nearly all the infection was confined to 2 places, a meatpacking factory and the city of Leicester. So, city of Leicester, that's perhaps 0.5%. The meatpacking factory was a very fraction, not very many people. And sadly, they didn't have very good testing, tracing and isolating still back then. And they just didn't manage to contain it, and they started growing and growing and growing, even though they did try quite hard. But they just hadn't got rigorous enough measures in place to stop these outbreaks, especially the one in Leicester. Leicester just simmered along all summer and then started increasing again. And then all the people coming back from Spain and so on. It's a long story. But what I'm saying is that Leicester outbreak could have been stopped by vaccinating just 0.5% of the UK population. Vaccinate everyone in Leicester. And that in addition to the R0, because when it went up in the UK, it was R0 was just, and in the US as well, the R0 never went above 1.3, even in the worst places. For the average over the entire state, or the average, some very local outbreaks go way higher than that, just for a little while. But if you can bring an R0 of 1.3, if you can halve it with vaccines, then it's well below 1. And so it's going to start going down. So adding a vaccine on top of, and then we'll have a better response this time around in the UK. You'll have a better response this time around in the US. and especially in the US with all the American rescue package and all that, you're going to have a much better. So by mid-March, and then add a week or so for the package to start taking effect, and then noticing noting the effect on cases by the end of March, then you've already got this steeply falling cases. You don't need to worry about the variants, because as I said, that even in South Africa it's even the worse the variant, the faster it goes down even. And it seems quite likely that would happen in US too. People just take it more seriously. And I personally don't think that these variants are going to be a big deal, as long as it leads to people stepping up on public health measures, because public health measures work with them all. And you just got to be a bit more vigorous with them, and people are being more vigorous. So you've got it coming down fast anyway because of the public health measures. You've got it coming down also because of the vaccines, which are leading to fewer cases amongst the people who are vaccinated. So that means that what would have been 100 becomes eventually 10 in that population, or even 5. And then you've got hospitalization and deaths way down by sometime late March, mid to late March. And then on top of all that, you've got this American rescue package and the $350 billion, which just sent keys in at that moment, at the point when it's already gone down a long way, hopefully. And the CDC are going to do this properly. Sadly, in the United Kingdom, it's all talk about, how quickly can we let up, and, a lot of pressure from his own MPs. The UK Prime Minister doesn't have the level of authority of a US president anyway. He's not a president. He has to do what his party wants him to do, just to a fair degree. And if he loses his majority in the House, then there's a loss of confidence. Luckily, he's got a huge majority, but even so, he could lose confidence of the House if he goes too much against his own party. That's the way it works in the United Kingdom, and then he'd be out of a job. It's a very different system from the United States, where the president can have very much more personal direction, and he is completely immune from anything happening to him until the next election. So, anyway, in the United States, Biden is supporting the CDC. The CDC are very strong on this, and they are very scientific. They follow. When Dr. Fauci talks, he's not giving his personal views. He's giving the systematic, judging the science by by the methods, not by the results. That really is the essence of what a systematic review is, and that is what he's not talking about his personal opinions. He's talking about the conclusions of review of the scientific literature through the US CDC, and he is summarizing that and saying this is what the science says. And the science definitely says that once you get down to a few cases, you should ramp up and up and up and increase. And so this rescue package is going to come at just the right moment for that, to really push it way down very fast. And so we should start seeing, I think we're going to start seeing things like where's the Medina one? Medina County. I think we're going to start seeing stuff like this happening all over the place in the United States, just very fast falls. As a result of so many things coming together at last, they've got the different pieces of the jigsaw puzzle together. They've managed to get the whole picture working now, and that it's been proven around the world that when you do this, then you can contain it and stop it. And what we're going to start doing is getting these green counties, and then once a county's green, then they're going to want to keep it like that. And then eventually we're going to get entire green states. Will it be Hawaii? Will it be New Mexico? I don't know which will be the first one. But at the moment, New Mexico has a quarantine, and it quarantines any visitor from any other US state, except Hawaii, where it is somewhat it's recommended but not actually enforced. And because Hawaii is the only one that's got a better situation than New Mexico. But last I checked anyway, and this may have changed because it's falling so fast in many states. But so New Mexico might just take for instance, it could be Texas, it could be any state if it goes in really, really fast. But suppose just for instance that it is New Mexico, and they reach 0 cases per day. They have the first days with the 0 cases, then eventually they have the first week, their first fortnight. Then they're going to want to keep that quarantine in place. And New Mexico with a quarantine will be very like New Zealand with a quarantine, or Australia with a quarantine, and it will be able to achieve and keep 0 COVID. And so there is a thing in there's a thing in the U.S. Constitution that there is a right of freedom of access of any state to any other one. So normally any citizen in any U.S. state can travel to any other U.S. state. But it's clearly that during this pandemic, then some of the states have put strict quarantines, like New Mexico have. So I don't know the legality of how this works, but it must be that I think it must be that the health requirements and is overriding this situation. It doesn't mean you've lost your rights to freedom of access to any state. It just means that this is a situation where it has been necessary to prevent people coming in and out. Just like you haven't lost your rights if you're forced to quarantine because you've got Ebola, or forced to isolate because you've got Ebola. So, so that right for any American to access any state is still there, without needing to. But some states are introducing quarantine travel restrictions because for health reasons. So I think that's what's going to happen, is we're going to start having states in the United States that have 0 COVID, and then other ones that don't. And then the ones that have 0 COVID, then just like with New Mexico and Hawaii, they'll start having travel corridors between them. And you can travel around between any of those. But then if you go to one of the ones that haven't achieved it yet, then you'll need to quarantine. I think that's quite a likely thing to happen. And so it's Germany has plans to do something similar intentionally. They want, at least the people in Europe who are calling for 0 COVID, and there's ideas in Germany, for instance, to divide up into regions, and each region can go green and be no COVID, 0 COVID eventually, and then join it all up. And I think this is going to happen as a natural thing in the United States because of the federal system, that because the states have an independent decision making, and that once they get to 0 COVID, I think they're going to decide that they want to stay like that. Because who would want to let it in again once you got to 0 COVID? So that's just me hypothesizing, but I think it's quite likely that this is what we see in the United States, because of the combination of the CDC being very strong, the $350 billion of support being injected in at just the right time, when to really help states to bring it way, way down. And then there'll be the example that it just needs one state to do it. Then others will look over and say, look, Hawaii's done it. They'll probably say, oh, Hawaii's an island. But New Mexico's done it. Then they won't have that same excuse. And then they'll start saying, well, maybe we can do it. And the thing is that really there's no difference between doing it with the vaccine or doing it with public health measures. It both works the same way, that you are reducing the R naught. And so long as the R naught is below 1, then the cases per day are going to keep going down. It doesn't matter how you do that. And if you do that by just vaccinating the super spreading regions, and then also public health measures everywhere, then it'll still, as long as the R naught is below 1, it'll keep going down until eventually it's gone. And it's basically the same thing as a vaccine, as using just a vaccine or using just contact tracing. And it's combining them together. So that is why that's why I'm pretty certain that I don't see, it just doesn't make sense. There's no way that New Zealand is going to let the virus into New Zealand, or China let it into China. Not unless they can tame it to the point of which it's a cold. But I think that United States parts are already very close to 0 COVID because of the individual counties. I think the next state might be some metro areas. They're much more difficult. It could be particular states. I think we're going to get larger and larger. First temporarily 0, and then eventually 0 for a week, 2 weeks and longer. because they, so long as they stick the course, and it would help a lot if there's a country, the CDC will certainly be behind this. They'll say, keep going down, put everything you've got into it. And as you get down to just a few cases per day, and most of your state is COVID-free, then you can relax your restrictions over most of the state. If it's pretty much COVID-free, if it is really COVID-free, and then you get these occasional outbreaks, then you have the temporary lockdowns around the outbreaks like happened in Australia. And then they're eased again. And remember, Australia has the disadvantage that there's a lot of COVID in the rest of the world, but with the whole world going down, then there's less and less ways of chances of it coming in, especially if all the surrounding states are also doing the same thing. Then and you've got quarantine, for some of the states doing quarantine and so on, then I think we're going to get less and less and less. And it's going to get to the point where you've got only a few cases per day, 0 cases per day, and then like happened in New Zealand, that you'll have a week without case, maybe a case pops up, and then you go in very strict around wherever they are, and then eventually you've got no local community spread left anymore. There are no cases in your state that came from previous infections in your state, and the only infections that you get in your state are people who came from other states and brought it from another state. And then if you've got your quarantine, you can stop those. And then eventually, once you've done that, you are now a zero COVID. Your state is now zero COVID. And then the states will join up, and then eventually maybe you gradually go back, and eventually, who knows, some state, California maybe, then they haven't been very good at controlling it, so maybe California will be, but they may quickly turn around. But they might end up being the state that's left that's still got cases when everyone else has got rid of it. Because it's a very big, very populous state that's had an awful lot of trouble in controlling, or it could be Florida or Texas, who knows. But there'd have to be a last case state that still has cases. And then all the efforts of the entire United States can be focused on that one state. And they'd be sending billions and billions of dollars of support to help them to control their last few remaining outbreaks. And then all the other states, once they've been zero COVID for a fortnight, then they can start opening up, and they no longer need to do physical distancing. They just be like New Zealand. And people say, oh, but New Zealand's an island, but China did it, and China's not an island. And they have these occasional outbreaks, but then they stop them. And Laos and Vietnam, you don't have to be an island. So I think it can, given that we already have the precedent that New Mexico is doing quarantine, then I think it is possible that it could happen state by state across the United States. And if it's done this way, it could happen long before you can vaccinate everyone. Because you only need to vaccinate the hotspots, and county by county, most of your state has eventually eliminated it. Then you've got a few hotspots. Then you go like in the United Kingdom, when we had only Leicester. Then you could in England, it's the main hotspot in the country. And so I in any case, whatever happens, it's looking very good. It's looking very good for the future. And the good news also is that that the COVAX Alliance is last getting its doses and going out to other countries like Nigeria, and I think it's absolutely appalling that the United Kingdom, where I am, is not sharing its early doses with other countries at all. So it has donated a huge amount to the COVAX Alliance, so it's supported it that way. But the COVAX has had difficulty in securing very early doses, so they've secured their doses, but with quite a slow ramp up of a few hundred million in February, March, April, and only gradually goes up that they managed to get enough vaccine. So that's why, and the rest of the world has far more vaccine than the COVAX has managed to secure it for the early stages of the vaccination rollout. So I think that the wealthier countries that have managed to secure so much vaccine and for themselves because of basically the power of the amount of money they've got, and they should share some of their vaccines like India has done already with Bangladesh and with several other countries near India. And I think the United Kingdom should do the same, and we should share partly with our European neighbours and partly with the very disadvantaged countries which otherwise won't have the dose for quite a while. For instance, Nigeria, then it takes until the end of June before they can vaccinate 4%. And the United Kingdom, I think it's 20% now or something. And it's just not right. If the way I put it is, imagine that you're in a queue and you look around and that these elderly 80-year-old and 90-year-old people from Africa and India and even some South America as well, they're quite a bit behind the United Kingdom, and then you've got health workers. They've just come off their shift and they've got all their protective gear, and you know that some of these are dying right now and some of them are sick, and there's this long queue of people waiting for a vaccine, and then you look and you see that you're right at the head of it, and you're young and healthy, and in my case 65, but I'm very easy able to protect myself, and so I see myself as just about zero risk, but I couldn't see any advantage. I thought I'd just cause a problem if I'd kind of say that I don't want to have my dose now, because they think I'd be vaccine hesitant, which I'm not, and and it would cause complications for their vaccine rollout, and it wouldn't help anyone in Africa, because UK wouldn't give that dose. It would just keep on trying to give it to me. It wouldn't give it to Africa. So I didn't really see any advantage in postponing my dose. So it could have done a bit of advantage maybe for people in the United Kingdom, but even then it just couldn't mess up their roll-up. I didn't really see it was a very useful thing to do. So but if you look at it like that, if I was in a queue, I mean, why should I be right at the head of the queue as a 65-year-old when there's people of 70, 80, 90 who are dying of COVID right now in Nigeria, Congo, places like that? It's not right. And all the people who are working on the helpline, they're risking their lives to save people's lives, and I'm not risking my life at all. I'm not in the hospital trying to wearing PPE, and if I make a mistake then I could end up having COVID. So why should I be vaccinated before these people in Africa? If you can imagine like a long queue and you see these people, if you were in a queue, even if they're just say there are 10 of you, and there's you young, healthy, or reasonably young, 65, I still think of 65 as being fairly young, but as you grow older, then your idea of what's a normal age kind of ups a bit, and you start thinking everyone else is very young, I looked at the nurses today and I thought, oh, how young those nurses are, they're like almost like children, because they're several decades younger than me, and so you start thinking of everyone else as young, not as you as old. Anyway, and then you think the older people as being the old ones, and so anyway, just the way you sort of kind of go as you get older. So, but anyway, I've got maybe 1 in 100 chance of dying, but none, really practically zero, if I because of the precautions I take. And so if I was in this queue, and then there's there's health workers and elderly people on canes, and people with lung conditions, on people who can't even breathe without support, and so on, and if I was in a queue and there were 5 or 6 people like that, and there's me, I'd say, go in front of me. Of course you would. Anyone would do that. You say, go in front of me. You're first. You're far more important that you get the vaccine than I do. But I just can't do that. It's just not permitted. If I tell the nurse that please give my vaccine to someone in Africa, she can't do that. It's just not permitted. So that has to happen at the government level. I actually had a dream where I dreamt that I was I bought vaccines in a local shop and sent it off to someone in another country, but we can't do that. So it just doesn't work like that. So anyway, but but do get vaccinated. It's very good to get vaccinated. And as I said in my previous video, if you get vaccinated, then if you're at any risk at all, and also just to help your country to complete its, by helping my country to complete its target, then they can quickly go through their vaccines, and then they'll have more vaccines then they will start thinking, once they vaccinate everyone in the United Kingdom, or nearly everyone, then they will start thinking about giving their excess vaccine doses to other people. There's some pressure on them to try and do that sooner than that, but not very much. It's not what they're talking about on TV. They're just talking about how quickly can we vaccinate everyone in the United Kingdom. It's even in terms of self-interest, it's not the right thing it's not a good thing to do, because our economy is not isolated from the rest of the world. When the rest of the world is struggling with people dying in hospitals, and then their economy suffers too. That affects us. And then variants are rising in other countries, and those variants then incubated because they weren't able to bring down their cases, and because they weren't vaccinated, they weren't stopping it. Then that's going to affect us too. We need to stop it everywhere, as quickly as possible. And we need to protect the health workers and protect the elderly all around the world, and then we can bring the world deaths, and not just the UK deaths, down, but bring down the deaths in the entire world rapidly down. So if you're in any position of influence, then do try, see if you can in some way or another, try to at least kind of share that idea with your friends and so on, that it's, and you can sign. I've already done a video about it. I'll put a link in the video description. You can sign the World Health Organization Vaccine Equity Declaration, where you're saying that the vaccines we need to work hard together to make sure that vaccines go not just to the wealthy countries. They should continue with their vaccination, but we should also vaccinate the entire world, and we will do eventually, and much faster than has ever happened with any previous vaccine rollout. So we've certainly made progress, but I think an extraterrestrial looking at humans and looking at how we're dealing with these vaccines would think that we're just making the first steps towards being really civilized. And we're part way there. At least we are going to vaccinate probably the whole world by 2022. But we have the capacity in vaccine manufacturers, if we really stepped up and put money into it, even more than we're doing already, then we could vaccinate everyone this year, and in the entire world who wants the vaccine. We've already got all the wealthier countries, most of them are going to be able to vaccinate everyone this year. It's mainly a case of managing to get the vaccines into the arms fast enough. They have plenty of vaccines secured to vaccinate their entire country this year. And they in fact are going to have a huge excess. And if assuming, which surely they will, that they give that excess to other countries, then we should vaccinate at least half of the world population this year, because we've got 27% already that COVAX will be able to do by the end of the year. And then there's about the same amount as, again, and a little bit, maybe even a bit more, in terms of secured doses that the richer countries have already. For instance, the United States, with 4% of the world population, has pre-ordered enough doses for about a fifth of the world population. And so just the US alone, once it's finished vaccinating its 4% of the world population, then it'll have a huge excess of doses for the rest of the world. US alone is going to make a big difference to the rest of the world. US has ordered more doses than the COVAX Alliance, but pre-ordered. The COVAX Alliance is supplying 92 countries around the world. So we will have plenty of doses, mainly because the vaccines ended up being so effective. But the vaccines were so effective and because all the vaccines, just about all the vaccines are being approved, apart from mainly some for various reasons being not going through at a very early stage, usually phase 1 or even before then. So that's so we've got lots of, and the World Health Organization going to I mentioned that India is giving doses to other countries. So is China, and so is Russia. Those are the 3 main countries that are giving their doses away to other countries. And then other people say, oh, that's vaccine diplomacy, and we actually get people criticizing China for giving away its vaccine. China, most people in China don't want to be vaccinated because they've got just about zero risk because it's zero COVID already. So China has a large excess of vaccines, and it doesn't feel a priority to vaccinate its people. It's clear it's going to keep going at zero COVID. I can't see China letting the virus in. So they don't really need much vaccine except for people who are leaving China. So that's why China has so much vaccine to give to the rest of the world. It vaccinates some of its own population, but there isn't really much take-up in China, not because they are dubious about the vaccine, but because they just don't see the point, because they see themselves as having no risk of getting COVID. So that's why China has such a big excess of vaccines. And then Russia has vaccines to spare as well. And so these people are giving their vaccines to the rest of the world. Why can't the United Kingdom, Europe, the United States do the same as them? Instead, they just criticize, oh, that's China trying to get in the good books of everyone by giving them vaccines. Well, why don't they, if that's the way of getting in the good books of other countries, why not give them vaccines yourself? Surely that makes sense, rather than just criticize China for doing it. They don't tend to criticize India for doing it, but they do criticize China, and they do criticize Russia for doing exactly the same thing. Anyway, so I think really I feel very strongly we need to turn this around and really make a big difference around the world, and really the more we can do this, the better. But so things are looking very good, but things are looking very good in the world as a whole. It's just that it's delayed. But for instance, India, and it's not because of vaccine, they're only about less than 1% vaccinated, and they're giving away their doses less than 1% vaccinated. But India has had its cases decreasing ever since September 2020. And so it had good public health measures really quite early on in the outbreak. It went up. Then it turned around a sharp peak, much like the US did, but much earlier. So the situation is actually, it turns out that some of the worst cases of Brazil and Mexico, they are both very good. Brazil can make its own vaccines, and Mexico and Brazil, they both ordered enough for their entire country. South Africa as well, then they're well able to vaccinate everyone, and so they will be a bit ahead of the COVAX, although not nearly as far ahead as the United Kingdom or Israel, most ahead. So it just so turns out United Kingdom, one of the worst, we actually, in a way it makes sense, the UK has had one of the worst outbreaks of them all because of our very poor public health response early on. But we are responding in the fastest way with the vaccine. In a way we didn't need the most vaccines, in a way. Not the only country that needs so much vaccines, but we were one of the top priorities to get vaccinated because we had so many cases per population. United States was another priority. Brazil and Mexico are priorities. India is a priority, but India is reducing it already by public health measures, and it's a big vaccine manufacturer itself. And Bangladesh, well, it got its contributions from India, and so on. So it's sort of working by happenstance that many of the worst affected countries that need vaccine quickly are actually getting vaccine quickly, either because they're wealthy enough and they've managed to secure bilateral deals, or because they have a friendly neighbour, in the case of Bangladesh, for instance, and India was given 3 doses to Bangladesh. But there are gaps, like for instance Nigeria is a gap. So there are very populous countries that are not really going to access enough doses but quickly enough to be able to be anything like on par with the rest of the world. Although by the fall and the end of 2021, we can expect the most vulnerable around the world to be vaccinated everywhere. We should do it a few months earlier. Anyway, so hopefully, so the situation is looking good, and no matter which country you're in, eventually we're going to crack this, and we're going to stop this. And personally, I think we're going to end it. People talk on and on about experts saying it's going to be endemic in the United Kingdom, and for instance, so on. I don't understand why they say that, because if you've got the public health measures and you've got the vaccine combined together, you've got to be able to reduce it below 1, and we've got cases reducing so fast. It just makes no sense. If you're going all the way down, you're nearly at 1, at 0. It makes no sense to let up so much that the R0 is increasing. You just need to keep the R0, including with the vaccine, and then some other measures, maybe not very strong measures, just enough to keep the R0 still below 1. Once you get down to 1 case per million, then just do enough of everything else to keep the R0 below 1 at that point. Even if it's just 0.9 or something, eventually it's going to go away. And that could be things like targeted vaccination and targeted very small lockdowns whenever you have an outbreak. So, I mean, that's what I expect. I expect us to eventually make the sensible decision. I think it's a sensible decision to go to 0 COVID. But on the way there, then it's going to take quite a while to turn people's minds around and to realise that is something they can aim for. And then another thing that the World Health Organization said today, earlier today, or was it yesterday? No, it was yesterday. I think it was Mike Ryan was talking about this is the first generation vaccines. So we're going to have, if the COVID-19 does, we haven't got rid of it by 0 COVID this year, we're going to have 2nd generation and 3rd generation vaccines, and they're going to be more effective at stopping the disease and stopping transmission. Science doesn't stop. It's not just they're going to be able to stop the variants. There could be much less variants in a world with very few COVID cases. And then the vaccines are going to improve in their capabilities. It's just going to, like for instance, just the dosing. For instance, AstraZeneca, first of all, they were using 4 weeks, 4 weeks dose, was it 4 weeks or 3 weeks, I think. They discovered 12 weeks dose is much better. Mixing AstraZeneca with Pfizer, who knows, maybe that is better than either of them separately. So there are loads of things they can do just with the current vaccines. We've got many new vaccine candidates coming along, and the vaccines are not all the same effectiveness against the different variants. For instance, China, then 2 of the Chinese vaccines are whole inactivated virus, and the whole virus instead of just the spike. That is likely to have the whole virus instead of the spike is likely to trigger a stronger immune response, antibodies to many different parts of the spike of the whole virus, which will then work against multiple variants. So it's not impossible that the Chinese vaccines, that the whole inactivated vaccine actually ends up being the better one, even though it's not nearly, it's really quite an old technology in a way, but it might, who knows, maybe that actually is a good way of doing it. And so they're trying so many different things with so many different vaccines. They're also therapeutics. For instance, a therapeutic drug that's designed to kind of latch into a particular slot in the COVID virus, which would stop it working. And so you have these tailor-made vaccines based on and those have to pass through more stages to get to the final product. So by the end of 2021, we likely have more therapeutics and better therapeutics. We get a few drugs from time to time, then gradually we have the really customized second and third generation of everything, and then that'll be even more effective. So one way or another, we don't need to stop now and say, oh, we've only got a 66% transmissible effective at stopping transmission, if that's what it is with AstraZeneca, or 50%. This is going to improve. There's no way that the first ones are going to be the optimal ones. So really, one way or another, we are going to get control of this virus, and I think that we're going to eradicate it myself. It's either eradicate it or tame it so much that it's really no different from a cold, and less serious than the flu. Because countries that are zero COVID, they're not going to let it in if it's as serious as a flu. Who would add an extra flu disease to their repertoire of diseases? But if it got way down to be just like a cold, that might be an alternative way, where eventually China would say, well, it's no more serious than a cold, so we can let down our borders, and New Zealand and other countries. So I think those are the end states, really. Anything between that, then you've got the world divided into two regions, the zero COVID and the non-zero COVID. And then either you end up with it being everywhere, but it's just very mild, it's just another cold, or you end up with it being zero COVID everywhere. And anything else is not a stable state. Gradually, countries are going to move into the zero COVID region, one by one, so it's not stable, and eventually it ends up with everyone zero COVID. I think that would be the end point, and it's only really a question of how long that takes. So that my mathematical way of looking at it, if you know what I mean. That's how it seems to me, that just kind of basic maths, and plus adding to this idea that zero COVID is a one-way street, and things aren't going to go back again. So I think we're headed for zero COVID myself. But one way or another, it's a much better situation than it was before these vaccines, and before the new variants, which actually triggered a much better health response, or whatever was the reason, and because of Biden and having at last a president that follows the science in the United States. This is not because he's a Democrat. Trump was following the science to start with, and if he had kept following the science, I think he would have been re-elected myself. If he hadn't done that switch and started attacking his own public health servants, his own public health advisors, and if he'd followed their advice and followed the CDC advice and supported them, then I think he would have won the last election. So this is not about what party you belong to. There's nothing Republican about being sloppy about health protection. This is just about whether a president is one who follows the advice of, who cares about and is very careful about public health, and who follows the advice and recognizes the way that science works, and what the place is of science in a response like this, and how important it is to base whatever you do on the best available science. Anyway, that's what we're doing now, and I do hope that the United States also has a good influence on the United Kingdom, which is, and then just to say, the last thing, that I've said this before, but just quickly touch on it, that the reason China did such a good job is because it's not because it's authoritarian. It did a really very poor job with SARS. It's because the doctors in China had previous experience of SARS, so they very quickly noticed that this was something, and long before a doctor anywhere else would likely have noticed it, they had systems in place to pick up on SARS. They only picked up one day after the doctors did. They and the epidemiologists, and basically it's the health workers in China, it's not the government. And then they had the advantage that having the ear of the government, then because it's authoritarian, and they happen to have a good strategy this time, which they didn't for SARS, and then they could quickly spread it out over the entirety of China. But the reason it's a good strategy is because of the public health in the nurses, the doctors, the epidemiologists, the researchers in China, and those are the ones that the reason for Chinese success, and because they followed the science. And again, just like with Trump and Biden, then if Xi Jinping had been someone who didn't follow science, and did things for other reasons, for political reasons, then China would have had as bad a response as the US did. But they learnt from SARS, and Taiwan as well. They learnt from SARS, and they developed a really good response, and that definitely works. We know from this serology data in China that they have very low prevalence of antibodies to COVID over the entire country, and we're talking about a fraction of less than a tenth of a percent over most of China of the infected by COVID. So this is very promising for future pandemics. So people also worry about future pandemics, and this is really very promising for future pandemics, because we have now all been primed. We know what a pandemic is, and for at least another generation, then we can expect that people are, as long as there's very strong motivation to retain, and we remember, we have the muscle memory, as Maria van Kerkhove puts it sometimes, the muscle memory of how to respond to a pandemic, that like this one, a very serious disease that can be stopped by test, trace, isolate. And so this is really, the rest of the world, and that's partly why we are managing to bring it down now, that we have learnt the lesson that China learnt in 2002. We have learnt it in 2020, and we are applying it now in 2021. And I think that is an awful lot of what is happening here, is that at last countries are learning from what happened last year. So some were very quick learners, like New Zealand, and others are quite slow learners, but we are gradually all getting up to speed in 2021. And by now that we are up to speed and working together, we can stop this pandemic, we can hugely improve the health systems of our countries around the world, and not only that, we can start thinking about eliminating other diseases. There are half a dozen different diseases that we could eliminate in the same way, actually easier to eliminate than COVID. There are several diseases with effective vaccines that could be eliminated from the world if we had the same political goals behind it, the political initiative to do it, and the same amount of finance that we've had for COVID. We could maybe even have a shot that eliminates half a dozen different diseases from the entire world all in one go. The four diseases have been eliminated from the Americas, and they would be completely gone if the rest of the world had as effective a vaccination program as the Americas have. So, that's three very low-hanging fruit. They're gone from the Americas already as an endemic disease, and so that's rubella. Smallpox is gone from the world. Rubella, polio, and what's the third one? I forget. There's a third one that'll come to my mind in a minute. But so that's four diseases that's three more diseases we could add to smallpox and eliminate from the entire world. And so I think there's a possibility that we reach 2030 with several diseases that we have in the world today just gone. It's scientifically possible, and we are beginning to have the political will to do that as well. And again, it's of no benefit to the United States for the world to have measles in it still, and the amount of money that the United States would need to contribute to a world vaccination program to eliminate measles from the entire world, it could even do it all itself without really noticing. It would just be to have kind of pocket change almost for the United States. to spend out enough to eliminate measles from the world. So we can certainly, once we've got the will behind it and the public acceptance that this is a good thing to do, then we can get rid of these diseases, and then nobody ever is going to have measles again for all future history. Thousands of years, it's just gone. And nobody will have rubella, and so there'll be many diseases like that we can just eliminate, and they're gone. And then, that's our future. That is a possible future. And if you look at us, as maybe a century from now, our descendants, they'll say, I wonder why it took them so long to eliminate those diseases, because they had the capability to eliminate polio, for instance, in the 1950s. Why did it take them nearly a century or whatever it is that it takes? We are close to eliminating polio. We did eliminate smallpox, and they might actually be quite puzzled as to why it took us so long. But it's certainly well within reach, because we already have the tools to get rid of them from this world. In a future world where people are used to just not having diseases, if a disease can be vaccinated against, then it's gone from the world. In such a future, then they would look back at us with great puzzlement, because we had the vaccines, it wasn't much financed compared to the world economy to get rid of it. It was just that it wasn't made a priority, and instead we prioritised building lots of weapons. And it's far more important to build a nuclear submarine than to rid the world of measles. And it's quite a strange situation we're in if you think about it like that. But anyway, hopefully that will. Yeah. So I'll upload this and see what you make of it. I think hopefully this gives some of you a more positive view of what's happening. And my aim was to help some people who are very scared in Doomsday Debunked and who read some of the really quite scary stories, and they're not presenting things right. They're really not presenting things right. The science move. Oh yes, and there's one more thing with the variants. Then we are able to do a flu vaccine and update the flu vaccine twice a year, because we do it for the southern hemisphere flu season and then the northern hemisphere flu season. So when it comes to the variants, we'll be able to vaccinate in the same way at least twice a year, and probably faster than that, and we respond to new variants. So the various vaccine manufacturers are already working on ways of updating their vaccines to be able to vaccinate against the new variants if that's what's needed. So, and we can expect this science just going faster and faster as it has been through this pandemic, and people finding better ways to work and shorter ways of doing things, not any safety shortcuts, but other kinds of shortcuts of doing things faster, like Zoom meetings instead of conferences, and risking and building things before you have proof that they're actually going to work, and things like that. Anyway, okay, so I'll upload this, and so welcome to my channel. Do like and subscribe if you found this video useful. And this is I do this to help. I do this fact checking mainly to help the scared people on the Doomsday Debunked group in Facebook, and and then it's my blog on Quora and Twitter. You might find it interesting to follow me on Twitter, and but do join our group on Facebook if you are a fact checker, or if you are scared. Then there are quite a lot of people there who can help you, and we also welcome, but do read the rules at the head of the group, and we welcome fact checkers, and people can help the scared people in various ways. Just a reminder, do check the rules at the head of the group before you post a comment, because they are very important, and they are how the group works.